Today we celebrate the nurses of our community. Nurses in the emergency room and the public health clinic. Those in surgery and recovery. Nurses working in our schools, our churches, and other community settings. Nurses from intensive care to hospice, cardiac and cancer care. Nurses at the bedside, in physician offices, and nurses in our homes. Nurses are everywhere, and people will always need nurses.
My favorite thing about being a nurse, I think, is the opportunity to be a part of people's lives when they need me.
I love being a nurse because I love being with people.
But even sometimes 5 minutes, to them it's like you're spending the whole afternoon.
The most important thing is how you make other people feel good about themselves.
Something that makes a person a great nurse is their ability to go above and beyond what they think is just their job and make it more about the relationship with the patient and doing whatever it takes to make sure that that patient is getting what they need.
I will see you at your worst, when you're broken and afraid, when your words are filled with rage. I will love you anyway. I will love you anyway. When everything's gone wrong, I will try to make it right. When the darkness is too much, I will try to bring you light. I will try to bring you light. And this candle in my heart, it's not from me, it's not from me, but I will share it with you until you're warm, till you're home and whole and free. I will find you in your cave, and I will sit by your side. And even if you misbehave, I will nurse your wounds with pride. I will nurse your wounds with pride. And this candle in my heart, it's not from me, it's not from me, but I will share it with you till you're warm, until you're home and whole and free. Yeah.
You know, I see nurses as healers, and when I see a nurse who touches the soul of the patient, I see that healing just explode. And that's just such a blessing.
You know, nurses are the ones with patients, holding their hands, guiding them through this tremendous period in their life.
Here's my candle, light yours and you'll pass the light along, pass the light along. Oh, here's my candle, light yours and you'll pass the light along. Watch the flame grow strong. I will see you at your worst, when you're broken and afraid, and when your words are filled with rage. I will serve you anyway. I will serve you anyway. Hey, 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 I will love you anyway.
The need to be loved and cared for, the need to be accepted and understood. Nurses do that, and that's really at the core of nursing practice, is to meet those needs, recognizing there are sacred beings behind them.
You have to be able to see the big picture, but you also have to be very detail-oriented.
My favorite thing about being a nurse is seeing a patient smile and knowing that I did a good job and made a difference in their life.
She talked about how my laughter affected her healing, and I thought that was a nice compliment.
Being there in the time of need and supporting the families.
Dedication, loyalty, and kindness.
They're caring, they're loving, and they're accepting and understanding the people that they care for.
Being there to help the patient or the family in those last minutes of life is an important part of nursing, and probably one of the most difficult parts of nursing.
Is a privilege that not many people get the chance to have, and I think nurses, really good nurses, value that a lot.
Devote 24/7 of their life to your child and become an extension of your family.
When someone is in need, they kind of just reprioritize so quickly and help meet those needs no matter what else might be pulling them in a different direction.
Every patient that I see that comes in the door makes some sort of impression on me.
One of my favorite patients that I've had in the last couple of years, he knew that he wasn't going to get better. And he came to me and he said goodbye. And he said it in such a loving way that it will forever touch my heart. He knew he didn't have long, and he came to me to say what difference it made as a nurse, that I was his primary nurse. I made a difference in his life and continue it forever because it was the right job for me. It will forever touch my heart.
The kindest thing I've ever seen a nurse do was be there to hold the hand of a dying HIV patient who was in the hospital for a long period of time and never had one visitor.
90% of the time I love my job, but there's that 10% when it's not someplace you want to be. And but everybody is very passionate about their work, and that's why I love being there.
Because I was a patient, and I was really sick, and I was in intensive care. And I had a bed bath by a student nurse, and it was, I close my eyes right now, and it was the best feeling in the whole wide world. And she was so sweet, and she was everything that I learned way back when. And I got to receive it, and it's the only time I've ever had it, and it matters. What we do matters.
It's just touching their heart, touching the heart of another patient that you know you really made a difference in their life.
There is a candle in every soul, some brightly burning and some dark and cold. And there is a spirit who brings a fire, ignites a candle and makes his home. Carry your candle, run to the darkness, seek out the helpless, confused and torn, and hold out your candle for all to see it. Take your candle and go light your world. Take your candle and go light your world. Frustrated brother, see how he's tried to light his own candle some other way. See now your sister, she's been robbed and lied to, still holds a candle without a flame. So carry your candle and run to the darkness, seek out the lonely, the tired and worn, and hold out Take your candle and go light your world. Take your candle and go light your world. We are a family whose hearts are blazing. So let's raise our candles and light up the sky.
I love being a nurse because I love taking care of people.
One of the toughest things about being a nurse is feeling like you did a good enough job.
I have all the time in the world for you.
Darkest times, carry your candle, run to the darkness, seek out the hopeless, deceived and poor, and hold out your candle for all to see it. Take your candle and go light your world. Take your candle and go light your world. To the darkness, seek out the confusion. Hold out your candle for all to see it. Take your candle and go light your world. Take your candle and go light your world. Take your candle. And go light your world.
An educated, caring, empathic, highly skilled, sought after professional.
Passionate.
Committed to taking care of the patient, committed to doing the right thing for a patient.
A good listener.
Heart. My word is heart.
Advocacy.
I believe a nurse is the extension of my family.
One word for nurses, comforting.
I guess my one word would be love.
Caring.
To be compassionate more than anything else. And compassion means with passion. You know, more than you can ever give. It's all that you can give. Give it to the person that you are ministering to. And that's what nursing is. It's a ministry.
Nurses in our community are nurturing life. From the first cries of the newborn child through every health challenge that humans will face. They count the heartbeats and feel them too, while serving people with ultimate dignity, touching lives so close in as to hear the last breath of a sacred life. To all nurses, thank you for sharing your light.
Who wouldn't want to be a nurse? What a great career. That's why I went into nursing, just to make a difference.